Hey everyone, Dr. Mike here. We all know knowledge is power, and there's no better example of this than with life-saving skills. You don't have to be a doctor or nurse to make a difference in an emergency. Today we're going to equip you with 7 basic but incredibly effective skills that can help you take action when it matters most. From CPR to handling seizures, these techniques are easy to learn and can have a massive impact on someone's life. We'll break down each skill step by step, making sure you feel confident and prepared to handle emergencies. Remember, staying calm and knowing what to do can truly mean the difference between life and death. So let's dive right in and empower ourselves with these life-saving skills. Don't forget to subscribe, like, comment, and share this video to help spread this vital information to your friends and family. You never know whose life you might help save. Alright guys, let's talk about CPR or cardiopulmonary resuscitation. This is a life-saving technique that can help someone who's gone into cardiac arrest, meaning their heart has stopped beating effectively. Now, CPR might seem intimidating at first, but trust me, it's simpler than you think, and learning it could give someone a fighting chance at survival. In those crucial moments before medical professionals arrive, your actions can make all the difference. Think of CPR as a bridge keeping someone connected to life until the EMTs arrive with the defibrillator and more advanced medical help. By performing chest compressions and giving rescue breaths, you're manually keeping their blood flowing and oxygen circulating to their vital organs. Remember, every second counts in a cardiac arrest, and knowing how to perform CPR can literally mean being someone's lifeline. We'll walk you through the steps in a bit, so stay tuned. Okay, let's break down the basics of CPR. First, make sure the scene is safe for you to approach. Then check if the person is responsive by tapping their shoulder and asking loudly, "Are you okay?" If they don't respond, it's time to call 911 immediately. Next, lay the person on their back on a firm surface. Now, locate the center of their chest, right between their nipples. Place the heel of one hand on that spot and interlock your fingers with your other hand on top. Keep your arms straight and your shoulders directly over your hands. Now push down hard and fast, compressing their chest about 2 inches deep at a rate of 100 to 120 compressions per minute. Think of the beat of the song "Stayin' Alive." That's the rhythm you're aiming for. We'll be covering rescue breaths in another video, but for now, focus on mastering these chest compressions. Remember, consistent, high-quality compressions are key to keeping the blood flowing. Keep going until help arrives. Let's move on to another common emergency: choking. We've all had that moment where food goes down the wrong pipe, but sometimes, choking can be really serious, even life-threatening. It happens when something gets lodged in the airway, blocking airflow. It could be a piece of food, a small object, anything that obstructs breathing. Now, a choking person can't speak or cough, so recognizing the signs is crucial. They might be clutching their throat, their face might turn red or even bluish, and they might be struggling to breathe, often making high-pitched noises. If you see someone exhibiting these signs, it's time to act quickly and decisively. Knowing how to perform the Heimlich maneuver can dislodge the obstruction and literally be a lifesaver. Let's learn how to become someone's choking hero. The Heimlich maneuver is all about using abdominal thrusts to create pressure and force the object out of the airway. First, make sure you're in a safe location. Then, if the person is conscious and choking, stand behind them and wrap your arms around their waist. Make a fist with one hand and place the thumb side just above their belly button, below the rib cage. Now grasp your fist with your other hand, and give quick upward thrusts into their abdomen. Imagine you're trying to lift them up and out with each thrust. Keep doing this until the object is dislodged or until help arrives. Remember, speed and force are key here. We'll cover how to perform the Heimlich maneuver on yourself and on pregnant women in another video. Stay tuned for those important variations, but for now, mastering these basic steps can truly make you a hero in a choking situation. Hey guys, Dr. Vince here, and today we're tackling a common but potentially serious injury: burns. Burns can happen anywhere, anytime, from a kitchen mishap to a nasty sunburn. The first step is knowing how to assess the situation. Now, not all burns are created equal. We categorize them as first, second, or third degree depending on the depth and severity. First-degree burns affect only the top layer of skin and are usually characterized by redness and pain. Think a mild sunburn. Second-degree burns go deeper, causing blisters and more intense pain. Third-degree burns are the most serious, extending through all skin layers and sometimes even to underlying tissues. These burns may appear white or charred, and believe it or not, they might not hurt initially due to nerve damage. Knowing the difference between these burn types is crucial in determining the right course of action. Remember, this video is for informational purposes only, and doesn't substitute for professional medical advice. If you're ever unsure about a burn, especially a severe one, don't hesitate to seek immediate medical attention. Your health is always the priority. Alright, let's say you've got a minor burn, like a first-degree sunburn or a small second-degree burn. The first thing you want to do is cool the burn down. Run it under cool, not cold water for about 10 to 20 minutes. Avoid using ice or ice water as it can actually restrict blood flow and worsen the damage. Once cooled, gently pat the area dry and apply a thin layer of antibiotic ointment like Neosporin. You can cover the burn with a sterile, non-stick bandage to prevent infection and keep it clean. Now I know some people believe in home remedies like butter or toothpaste, but trust me, stick to the basics. These substances can trap heat, increase the risk of infection, and make it harder for a doctor to assess the burn if needed. Keep a close eye on the burn, and make sure to change the bandage daily. Most minor burns will heal within a week or two with proper care. However, if you notice any signs of infection like increased redness, swelling, pus, or fever, it's crucial to see a doctor right away. Alright guys, in this section we're going to talk about how to control bleeding, a skill that can truly be life-saving in an emergency. Whether it's a small cut or a more serious wound, the principles remain the same. The first and most important step is to apply direct pressure to the wound. This helps to slow down the bleeding and allows the blood to clot naturally. Ideally, use a clean cloth or sterile gauze pad, but in a pinch, any clean material will do, even your bare hand if necessary. Place the cloth or gauze directly over the bleeding site and apply firm, even pressure for at least 5 minutes. It's important to avoid lifting the cloth or gauze to check the bleeding, as this can disrupt the clotting process. If the bleeding soaks through the first layer, don't remove it. Simply add more layers on top and continue applying pressure. Remember, time is of the essence when it comes to bleeding. While applying pressure, have someone call 911 or get help immediately, especially if the bleeding is severe, doesn't stop after 5 minutes of pressure, or is spurting bright red blood. Now, in some cases of severe bleeding, especially from an arm or leg, applying a tourniquet can be a lifesaver. A tourniquet is a tight band that's applied to an injured limb to stop blood flow to the wound. They are typically used when direct pressure alone isn't enough to control the bleeding, or in situations where direct pressure can't be applied effectively, such as in a mass casualty event. It's important to note that tourniquets are a last resort and should only be used in life-threatening situations. If you need to apply a tourniquet, place it about 2 inches above the wound and tighten it until the bleeding stops. Make sure it's tight enough to completely stop the blood flow, but avoid placing it directly over a joint. Once the tourniquet is on, note the time of application, as this information is crucial for medical professionals. Remember, applying a tourniquet is a serious decision and should only be done in a true emergency. Always call 911 or your local emergency number as soon as possible if you've had to use a tourniquet. Hey everyone, today we're discussing a very serious medical emergency: stroke. A stroke occurs when blood flow to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. This can lead to permanent brain damage and even death. Now, there are two main types of stroke: ischemic and hemorrhagic. An ischemic stroke is the most common type and happens when a blood clot blocks an artery supplying blood to the brain. Think of it like a traffic jam in your brain's blood vessels. On the other hand, a hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding in or around the brain. Imagine a pipe bursting in your brain. That's the severity we're talking about. Recognizing the signs of a stroke and seeking immediate medical attention is absolutely crucial for improving outcomes and reducing the risk of long-term disabilities. Remember, time is brain when it comes to stroke treatment. So how can you tell if someone is having a stroke? Well, there's a handy acronym that can help fast. Each letter stands for a specific symptom to look out for. F is for face drooping. Ask the person to smile. Is one side of their face drooping or numb? A is for arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weak? S is for speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred or difficult to understand? And finally, T is for time to call 911. If you observe any of these signs, even if they come and go, don't wait. Call 911 immediately. Remember, recognizing a stroke and acting fast can make a world of difference in the outcome. Don't hesitate to call for help, it could save a life. And remember, this video is for informational purposes only, and doesn't substitute for professional medical advice. Hey everyone, it's Dr. Mike. Today we're talking about what to do when someone's having a seizure. Seizures can look different, some have full-body convulsions, others might seem confused or unresponsive. Stay calm, that's the most helpful thing you can do. Safety is key, clear the area around them, move furniture out of the way, don't restrain them, just keep them safe. If the seizure lasts longer than 5 minutes, call 911. Once it subsides, roll them onto their side, stay with them, offer comfort. Alright, now that we've covered what to do during a seizure, let's talk about what not to do. And trust me, these are common mistakes people make with the best intentions. First up, never, ever put anything in the person's mouth. I know you might have heard the myth about someone swallowing their tongue during a seizure, but that's simply not true. In fact, trying to force something into their mouth could injure their teeth, jaw, or even block their airway. So just remember, hands off. Next, don't try to restrain the person or stop their movements during the seizure. It's natural to want to help, but holding them down can actually cause more harm than good. Remember, your goal is to keep them safe, not to stop the seizure itself. And lastly, don't panic. I know it's easier said than done, but staying calm will help you think clearly and provide the best possible assistance. Remember, seizures are often more frightening than they are dangerous, and most people recover completely with a little time and care. So stay calm, follow these simple steps, and remember, you're doing great. Knowing what to do in a seizure situation can truly make a world of difference. Alright, let's talk about being prepared for those everyday mishaps, because let's face it, they happen to the best of us. Having a well-stocked first aid kit is like having a safety net for those unexpected bumps, cuts, and bruises. First things first, you'll need a variety of bandages. Think adhesive bandages in different sizes for those minor cuts and scrapes, gauze pads for larger wounds, and maybe even some liquid bandage for those hard-to-cover areas. And don't forget the medical tape to keep everything securely in place. Next up, antiseptic wipes and antibiotic ointment are your infection-fighting duo. Clean those wounds thoroughly with antiseptic wipes before applying a thin layer of antibiotic ointment to prevent infection. Trust me, a little prevention goes a long way. Now let's talk pain relief. Over-the-counter pain relievers like ibuprofen or acetaminophen are essential for managing pain and reducing inflammation. Just make sure to follow the recommended dosage on the label. Section 2. Beyond the basics. Now that we've covered the basics, let's take it a step further. Having a few extra items in your first aid kit can really come in handy. A pair of non-latex gloves is a must-have for protecting yourself when providing first aid. And don't forget a CPR face shield. You never know when you might need to provide rescue breaths, and a face shield creates a barrier for added protection. It's always better to be safe than sorry. A small instant cold pack can be a lifesaver for those bumps and bruises. The cold helps reduce swelling and numbs the area, providing some much-needed relief. And finally, consider adding a small flashlight and a whistle to your kit. These can be invaluable in emergency situations, especially if you need to signal for help or navigate in the dark. Remember, a well-stocked first aid kit is an investment in your health and safety. Keep it accessible at home, in your car, and even consider a smaller version for your backpack or purse. You never know when you might need it. That's it, everyone. We covered a lot of ground today, from CPR to handling seizures, and even building your own first aid kit. Remember, knowledge is power, and having these basic life-saving skills can truly make a difference in an emergency. If you found this video helpful, don't forget to give it a big thumbs up and share it with your friends and family. Let's spread the knowledge and empower others to be everyday heroes. Don't forget to subscribe to the channel and hit that notification bell so you don't miss out on any future videos. We've got plenty more life-saving tips and tricks coming your way. Until next time, stay safe, stay healthy, and remember, you've got the power to make a difference.